All right, welcome to Chapter 11. We're going to be talking about scene size up and some of the safety concerns that we might have with that. So the first thing we're going to talk about is just kind of an overview. On your skills assessment sheet under patient assessment trauma, we're talking about these points. The first one would be checking scene safety. We're going to talk about taking standard precautions, which we covered before this chapter, talking about the use of gloves and masks and gowns and so on. Next we're going to talk about is noting the mechanism of injury or nature of illness. So we're going to cover what those entail. We're also going to talk about determining the number of patients, and then based on all that, you're going to decide what additional resources may be necessary for you to complete this task. So with scene safety, the biggest thing we're going to talk about is how to protect yourself, what to be looking for when it comes to assessing your scene. The biggest thing to remember is the only real predictable thing about emergencies is the fact that they're completely unpredictable, and there can be some dangers posed to EMS providers. It's becoming more and more common, sadly, that EMS providers are getting injured or possibly killed on EMS scenes by people who intend to hurt or harm EMS providers and firefighters. One of the things we're going to look at, we're going to kind of dive deeper into, this stuff's not found in your textbook, but we're going to kind of talk about the way that tasks and skills work to or work with your attention and what takes away from our attention. The first thing is if you think about like task orientation, when it comes to utilizing a bag valve mask or CPR or some sort of assessment, what happens is because of these tasks involve quite a few details that we have to be pretty specific about. The danger is the fact that it takes away or consumes us and eliminates our ability to be aware of our surrounding as well. So the more complex the skill is, the more intention that obviously it requires. So in those circumstances, you need to make sure you have good communication with the rest of your team that will provide you some sort of backup or assessment to keep you safe. Situational orientation, this is the stuff when you're not engaged in a task, you're able to turn your attention towards the environment. This definitely facilitates the ability to see the bigger picture and allows you to look around and kind of take in all the environment as possible. That way you can keep yourself safe. Best way to practice these. It's not something that you're born with. It's something more or less that you practice and you learn. But what we're talking about is practicing your front door survey. So as an EMS provider, there seems to be some hesitation because of the fact that some EMS providers think that might be interpreted as uncertainty. So they tend to start a task or work their way into a scene without paying attention because they feel like if they take too long to make up they take too long to look at their scene, what might happen is the person they're with might assume that they are just hesitant or unfamiliar with the scene. But it never hurts. Most of us providers do this. Go ahead and just stop for a second, kind of take a look around, let the entire scene kind of come to your senses. That way you're not walking into or getting yourself into circumstances where there could be a danger. The things you're looking at with that big picture is you're going to ask yourself if everything fits. The placement of windows and doors, the living conditions. Are there any safety hazards that you can see from the road or possibly from your apparatus? And then right there in the very, very beginning, you're going to work on determining if you're going to need more resources throughout this event. Once you've completed a task, so let's say you are involved in those attention gathering skills like BVM or CPR, once you're done, kind of reorient yourself to that task. Take a look around, see if your environment has changed or something has moved or there's something new. Maybe someone entered the room that you didn't see before. But kind of allow that to kind of take a real quick glance around your scene to make sure there's not something new that could be dangerous to you. The other big one is when you're in charge, when you're in the leadership role, make sure that you act like it. Some of the toughest skills to learn, obviously, is scene presence. Make sure that the patient and family members know that you're there to help them, but also that you're trying to control your scene, you're trying to do your job. Leadership sometimes is easy for people to fall into that role. Sometimes it's something they have to learn and be challenged with. Personally, I think the biggest issue with leadership is understanding that possibly means you're going to have to delegate. The leader really is kind of a huge part of being that eyes while the other providers are looking down. So if you're in that team leadership role, that means you need to take a step back, let other people do some of the simpler tasks like take some vital signs or ask some questions. Your job is to take a step back, make sure you're always gaining that big picture and protecting your team. Make sure, like I said, if you're in that leadership role, that you communicate with your providers. Make sure you're still respectful to family as well as your other providers, especially different agencies, but make sure you have that strong leadership presence. So some more scene safety stuff. As you near the collision, there's lots of things that you can start picking up on or trying to notice before you even get to that scene. The other big one that we tend to see is people not paying attention for other responding vehicles. So make sure you keep your eyes and ears open. Also, the other big one is look for signs of collision-related power outages. What we're talking about is down power lines or darkness on a street that you know is normally well lit. Pay attention to that traffic flow to make sure that there's not lots of traffic backing up and that's providing some distraction or maybe possibly a red flag that the incident that you're being dispatched to is a little more intense than you once thought. The other obvious one is obviously taking a look at towards the scene to make sure there's no smoke in the direction of that car wreck or structure fire or something along those lines. That'd be a pretty good indication that there's something a little more serious going on. So once you can see the scene, still going to look for clues that indicate some sort of hazmat incident. What you're checking for is placards on trucks or rail cars if you're involving a train. If you notice this possibly could be a hazardous materials type call, I encourage you obviously to stop well away from the scene, utilize some binoculars to look at that placard, and then utilize your ERG, which we're going to talk about here very shortly, to try to identify the substance. That way you know how far away you should stay or possibly set up some sort of perimeter to keep everyone as safe as possible. Now, once you can see the scene, you're going to look for any smoke that you couldn't see at a distance. And then with that power outage stuff, if you didn't see anything before, now you're going to make sure there's no broken utility poles or down power lines or any other dangers that could possibly harm you, harm your crew, or harm any of the bystanders and patients as well. Within the site, still a couple more things is make sure that you're watching for people walking around the scene or on the side of the road, any people that may or may not be conscious. So that's going to be your job, obviously, to provide a safety cushion for them as well. If there are some other people on scene, some sort of emergency services personnel, police officers, fire department, other EMTs, something along those lines, make sure that you follow their directions, as they may have a place for you to park that's safe for you or that's going to facilitate the quick access to and from that scene. So we're going to take a look at this house real quick, and we're just going to kind of talk about some of the dangers that are commonly anticipated. I'll give you kind of a second to kind of take in what you think are the dangers here on this, and then we'll go ahead and start circling some of the things that could possibly be dangerous. All right, so looking at some of the possible dangers here, obviously it seems kind of silly for the size of the dog, but that dog sitting right here in the front part of this house could possibly be some sort of danger. I know he's not a very big dog, but we know those they can still bite you, they can still possibly harm you. A couple other things is the inability to see in and out of these windows. Most definitely the patient appears like they could look out and be aware of your presence, but you may be unaware of their presence. That's kind of a safety thing to be aware of. Obviously, when it comes to debris and stuff, if you're trying to get out of this house in a hurry, it could possibly be a little bit problematic of watching for tripping hazards, something along those lines. Once you're standing right here directly on the porch, you kind of lose your ability to watch both sides of you, some areas that possibly could be of danger. So all these things are a good idea to kind of just take in and kind of be aware of. Here's another one. Obviously this home is a little bit more well kept, but this does provide some dangers as well. I'll give you kind of a second to review the scene and see about possible dangers in this home. Let's just say, for the sake of this scenario, that your patient is sitting in this chair right here. So the areas to be aware of, obviously, is this banister overlooking you. If there's any sort of danger from above, most likely when talking to this patient, one person might have their back to this area or this area in here. Just making sure that everyone's kind of watching their surroundings. Just because this appears to be a higher end home does not mean it has any less dangers than the home previous. It still has the same danger qualities when it comes to taking care of patients. The other one, obviously, is, let's say our patient was upstairs. These stairs, walking up and down these stairs, can provide a safety hazard when it comes to moving around and carrying those patients up and down the stairs. This one seems a little bit silly, but the best way I could find to obviously talk about weapons and so on was to show you some of the things that they have. In this case, this has a hidden compartment in the bed that can hide a firearm. So asking about the presence of weapons, you're going to be in a lot of home when it comes to, or going to be in a lot of homes that have weapons and so on. Most of those homes are, the weapons are not going to be there to harm you, but there is that possibility of that happening. So asking about weapons, paying attention to people's hands, which we're going to talk about here very shortly. But this is just going to kind of show you that weapons can be hidden just about anywhere in a home. So just be aware of your surroundings and be aware of your patient presentation and patient movements. As you reach the scene specifically, obviously follow the instructions of the person that's in charge. If that's you, make sure you take that leadership role and start delegating tasks. Once you're on scene, this is where you're going to put on your appropriate protective apparel. If it's a car accident or something that involves bunker gear or fire equipment, reflective vests are going to be required on streets when it involves motor vehicle collisions or possibly just a medical emergency that occurred on the highway. That's going to be the biggest thing when it comes to protecting yourself to make sure you're not getting injured. We're going to talk about body position when it comes to keeping yourself safe as possible. Sadly, assault on EMS providers is on the rise throughout the country, so we're going to talk about a couple of the things that protects ourselves as well as our partners. A lot of this information I took from a company that's called DT4 EMS, and that's Defense Tactics for EMS. It's a program that provides some education and training to EMS providers to protect themselves. You can find some of their videos on YouTube or on some of the other EMS sites. They do have a defense program that's taught throughout the country that can teach you some ways of protecting yourself. It's not meant to be a offensive class. It's more of the defensive side to protect yourself once a patient has made the decision to possibly harm you or your partner. Outside the house, so this is a really good way to protect yourself and to make sure that you're not going to be injured. One of the things that we started doing was making sure that we're standing not directly in front of the door in case something happens or that patient opens the door and presents with a firearm, but standing off to the side to make sure that we're good and protected. Kind of looking at this house, I know this is probably a staged house of some sort, but there's a couple of things that immediately kind of red flag that could be a possibility of kind of the scene not adding up. One of these obviously is this lock that's on the door. That's kind of an interesting indication that maybe this home is locked up or boarded up in some way, shape, or form. The other one is the fact that it appears to be the deadbolt or something has been removed or possibly damaged. So taking those things in is pretty important. And also this window right here, this window doesn't really provide us to see into the house, but it allows the patient or occupant of this house to look out and get a good idea of how many people are there or if law enforcement's involved or something along those lines. So these are all kind of things that provide some safety hazards. So making patient contact when the patient is standing. I'm going to go over a couple of things when it comes to where you should position yourself. Realistically, on scene, not every single person on scene needs to be doing something to benefit the patient. Maybe one or two people are standing back to provide just some cover or some observation when it comes to safety. So a couple of the body positions here. This area right here, we're going to call this the inside area, and it's directly in front of the patient. Notice how there's this do not sign right here. That's because we really want to keep away from directly in front of those patients. The very best place for you when you're providing that patient care when it comes to assessment is over here in position number 2. Position number 1's not bad, but it still kind of gets you close to this inside area where they could possibly harm you with an upper body move like a punch or a push or something along those lines. Position 2 allows you the best advantage when it comes to if the patient turned towards you, then you're obviously going to adjust your approach with that patient. Position 2.5 and position 3, these don't provide the very best when it comes to assessment, but it does provide the safest area for you, but then you lose that assessment ability. So position 2 is the middle ground when it comes to the best safety position while still being able to do your job as an EMS provider. And then we're going to talk about is when the patient is laying supine or prone. In this case, obviously, this is the area you definitely want to stay away from at all times. That way you don't get kicked or injured in any way, shape, or form. We also don't want to be stepping over patients because that's just a danger for us as well as for them. When it comes to EMS as being the main provider when it comes to medical, in this case position 3 is the best place for you. You can monitor airway and so on, and this is the least likely position that they can harm you without any warning. So in this case you would approach your patient from position 3. We're going to look at a couple different pictures and talk about dangers in positioning here as we move forward. So this picture, let's say you're called for a man down in the park. As you approach this patient, I'll give you a second to kind of think to yourself about the best way to approach this patient or the best way to keep yourself as safe as possible. All right, so looking at this as you approach that patient, your biggest concern obviously is going to be your safety. So when you're looking at that, you definitely want to approach this person initially from this direction. That way you can holler out to this person and get them to make eye contact with you or possibly sit up. The biggest thing to be thinking about here is you have absolutely no way to control their hands or to monitor their hands. So in this circumstance, obviously, once this person regains consciousness or makes eye contact with you, ask them to take their hands out of their coats or out of their pockets for your safety and just for your comfort level is going to be pretty important. And then obviously just kind of watching this stuff you got here to make sure that they don't reach for anything or there's nothing that can harm you in this position or in this stack of belongings. In this case, obviously, from the position that we're in right now, it's real hard to maintain the ability to look at his hands. You can see the one hand, but obviously our concern is the other hand, as well as if we approach from this position, we're unable to check airway and breathing and circulation, as that's our main priority. So in this case, again, you're going to approach from that position 3. And again, you're going to holler out. You're going to see if he answers you, as well as making sure that he shows you his hands for your comfort level as well as when it comes to safety. All right. Oops, sorry about that. So this next one obviously got a couple of different safety hazards here. One obviously dealing with alcohol, making sure that bottle gets moved at some point. When it comes to approaching this patient, this position isn't a bad position to approach him from as long as you keep your distance until that patient regains consciousness or you determine that he is unconscious for sure. In this case, that position 3 is doing the very best possible, as well as making sure you can see their hands and body position. I would just make sure that the patient's aware once he regains consciousness that he knows that there's a ledge here. What you don't want is this patient to roll over and then possibly, it's not that far, but fall this distance and then impact the back of their head or the side of their head on the concrete. So just make sure you communicate with that patient. Make sure you keep yourself as safe as possible and maintain that posture and body position that keeps you safe. This one has got a couple different things going on it. Obviously, the big concern is this gentleman's holding his stomach or his chest, which means he's in some sort of distress. He is kneeling down. Again, I would just make sure that he keeps his hands within visual, so you can see them at all times, as well as finding out why he's holding his chest, if he's been injured, if this is a traumatic event. The other one that some people obviously miss is you are in the middle of a road, which means that you should be aware of the scene around you. As well as keeping yourself safe. You're most likely going to use your apparatus of some sort to block this to protect yourself. The other one is you got some traffic backed up here, so you might find out if this person has something to do with the event, if they know anything of about this patient, or know why this patient is on the ground. So there's kind of a lot of different safety things to kind of keep in mind. This one, this patient obviously looks fairly agitated. This one, you're going to want to maintain that position 2 to keep yourself as safe as possible. Even in that position 2, you want to leave yourself quite a bit of distance and some sort of safety cushion. So with that, like I said, maintain that position 2, talk to this gentleman, find out what's going on. We'll talk more about safety considerations in psych patients as we get farther into this program, but kind of keep those things in mind. So I'll give you a chance to look at these two pictures to see if you think that there's any safety considerations going on in either one of them. The positive side is we do see a lot of great teamwork and treatment in this picture, but I want you just to kind of look around and see if you can find any safety considerations or any dangerous actions being done by EMS providers. All right, so the things that we're looking are the safety considerations to be aware of, obviously, is in this case, all these individuals are looking at the patient. No one is really kind of watching their scene and, assessing their scene. I know they probably got some people here and here that looks like maybe there's some EMS professionals or, lifeguards or something along those lines, but you still need to have a member of your team watching for your safety at all times. And then, of course, even in this case, this appears to be a law enforcement officer who even his attention is drawn to the patient or what's going on here. It appears to be some sort of cardiac arrest, so still just making sure that someone's watching the scene. This one looks pretty good as well, except for, of course, again, looks like all 3 providers are watching the patient and doesn't see anybody that appears to be looking at the rest of the scene. And of course, here's that position I was talking about, that we don't belong kneeling over the patient or reaching over the patient. That way you don't harm them, they can't harm you. But like I said, in these circumstances, obviously just paying attention is going to be important. The other one is this oxygen tank appears to be being left unattended. It also appears in the picture like it's in a very good position that it would fall that could possibly strike this kid or this patient in the head. So obviously being aware of those. Got 2 examples I'd like to show you when it comes to scene assessment. So go ahead and watch these 2 videos, and they're going to talk about, then we'll talk about some safety things. So here in this video, you see this impact obviously over here. Of a truck into, it looks like a fire apparatus. Obviously very slick roads, that'd be something you want to be aware of. I also want you to kind of pay attention to this firefighter over here that seems to be wandering around looking for more traffic or looking for their dangers, or possibly looking for some patients. Sadly, you're going to see an impact right here coming up where a car slides into this accident and impacts this firefighter. Also want you to notice how many people come running to his aid, which in this case is none, due to the fact that no one really knows he's there. He was kind of wandering around in areas he probably shouldn't have been. So it obviously doesn't allow people to come help you when you're injured. Miraculously, this individual did survive. He looks like he's regaining consciousness. So a pretty amazing act here. But obviously kind of being aware of your scene is going to be extremely important. Here's another video that's going to kind of talk you through an incident that happened in Montana.
Every day, the men and women of the Montana Highway Patrol risk their lives safeguarding Montana's motoring public. To help them in this mission, we need your assistance. As the following video will show, slowing down when driving through crash zones is a critical safety measure that will protect yourself and others. And as always, please slow down and move over for emergency vehicles. On December 28, 2014, Trooper Wade Palmer and Cadet Timothy Templeton arrive at a crash scene involving a mother and her conditions were extremely hazardous during a blizzard. Shortly after arriving on scene, a chain of events unfolded that is captured on the following dashcam video. In the first event, you will see a semi crash into the family's vehicle as they sit in it. You will see several collisions following the first one. Please slow down in adverse conditions, travel safe, and thanks for watching.
Said medical, we just had a semi truck plow into the car that's crashed. 301, it's a 91, send medical quick. Get the medical bag out of the trunk. Ma'am, are you okay? Are you going to the truck? The door's locked. I'm coming. Get the tire iron. Get the tire iron. Ma'am, I'm trying. Keep talking to me. There's another lady missing. Yeah. 3 Apostle 58 crash. Ma'am. Watch out, watch out. Right out. We got one female in the median, bleeding heavily, still alive. Come on. We need more people. Heads up, heads up, heads up! Heads up! Watch out! Get out of the road! Everybody on the road! To the fence! Everybody get to the fence! We need to go down the interstate. We've had multiple near people hit. They are going like crazy. We got 2 semi-trucks involved in it.
Alright, so that's going to be the end of that video. So obviously you can see definitely some ways that hopefully we could have decreased the chance this would have happened. One of those ways would have been proper utilization of your apparatus to block traffic or possibly shut the highway down, or just sending a unit farther down the road to provide some warning to drivers. You can see most of the time through this video that people are still traveling at a pretty high rate of speed through this area. This is a pretty common occurrence. This happens quite a bit on our highways. So just making sure that people keep themselves safe and so on. Obviously in this circumstance, these law enforcement officers did a great job of protecting as many people as they could with the resources they had available. Working with danger zones and so on, specific guidelines. If there's no apparent hazard or threat, something along those lines, your safety zone needs to extend about 50 feet in all directions. That provides a safe area. Anybody within that red zone should be properly trained as well as properly equipped with safety equipment and so on. Fuel that has been spilled, obviously when it comes to leaking hazards like gasoline or oil, you need to extend that danger zone to about 100 feet in all directions from that wreckage or fuel. If there's a vehicle that's on fire, we're talking about 100 feet in all directions. If we have down power lines, we talked about those broken power poles or power outage related incidences. One full span of wires away from the poles to which those are broken and are attached. We never attempt to deal with down power lines. That's something that's going to be utilized by a power company to be safely remove those or turn power off to those power lines. When there is a hazardous material, we talked about using binoculars at a safe distance away to determine what that hazard is. What you're going to use for that is what's called the ERG, or the Emergency Response Guide. A lot of people call this the Orange Book. You can gain this app for your phone, as well as we have them in the ambulances and so on. You're just going to use binoculars and try to determine what hazard is leaking from the car, or what possibly could be involved in this incident. Crime scenes and acts of violence. The biggest thing is going to be paying attention for the threat to still be on scene, the thought of possibly a weapon, or fighting or something along those lines. Anytime we deal with signs of alcohol or their drug use, a house that there's some prior knowledge of violence, where maybe you have been assaulted in the past, all those things are important to note. That way you keep your safe and keep your crews safe as well. Alright, so standard precautions, what we're talking about is the use of body substance isolation. A couple of chapters ago we spoke about utilizing gloves or goggles or a mask. Obviously determining what body substance isolation you're going to use on every call is going to be important. No less than gloves is going to be the requirement when it comes to your safety. In Washington State specifically, they do require that EMS professionals wear safety goggles or eye protection as well. Now we're going to talk about mechanism of injury or nature of illness. We're talking about why EMS has been called. When we're talking about mechanism of injury, we're talking about trauma specifically. When it comes to nature of illness, what we're talking about is medical. These are usually broad determinations when it comes to what you're dealing with. A mechanism of injury would be a head-on collision, or a shooting, or a stabbing. You can kind of sum those up in a penetrating injury, but we don't get into specifics. Nature of illness is going to be also a broad topic. So patient calls and complains of chest pain. Your nature of illness might be cardiovascular, or your nature of illness could be respiratory. If you're not really sure why you've been called, then of course your nature of illness might be unknown, as well as your mechanism of injury. Different types of mechanism of injury. We're talking about the forces that cause the injury specifically, like we said, a front-end collision, or blunt force trauma, or penetrating trauma, something along those lines. There's a couple of different injury patterns that are associated with specific types of wounds and injuries. So that's where we get into pretty useful stuff when it comes to predicting injuries associated with motor vehicle collisions. Two of the terms that you see here, we see a term that's IOS, which stands for Index of Suspicion, which means, do you have a suspicion of a critical injury? And then MOI is how we label mechanism injury. So one of the questions we continually ask ourselves is, can you have an index of suspicion of a critical injury based on MOI alone? Basically means solely based on your mechanism of injury. So if the patient fell from 20 feet, can you provide some sort of index of suspicion for an injury? And of course, most of us agree that you can. You can have a pretty high index that the patient could have a critical injury or a life-threatening injury just by looking at the mechanism of injury specifically. I'm going to show you a video that we're going to kind of talk about. So I'll let you watch the video here, and then we're going to talk about the specifics along the lines with this. There is no sound in this video, just in case you're trying to work with your speakers. I know this is kind of gut-wrenching to watch, but this video is a little bit long. So it's not going to be this specific jump here. It's going to be the one following it. They're going to show this impact a couple of different times, and I want you to kind of pay attention to a couple of things. Here, obviously, you can see the initial impact. One of the big things to kind of look at is the fact that this person does not get up. That should provide you with some sort of indication the patient suffered a fairly critical injury, or at least an injury that could have caused some substantial harm to him. Like I said, they're going to show this a couple different views. So wait just a second till they review it, and you can kind of get an idea of the mechanism of injury that we're talking about here. So they're going to show it from this view one more time. This view does kind of show you the initial head impact as well as it with the snowmobile striking this individual in the chest. This view is just a little bit zoomed in. The next view is actually going to be the best view when it comes to providing a different look at this incident. So this is the view I was talking about. Of course, you can see the initial head first, and then you can see as this patient roll over, that snowmobile strikes him in the chest as well as the head. Injury-wise, this individual did have a concussion as well as, I believe, some sort of brain bleed. He also suffered a bruise on his heart that caused the blood in the pericardial sac to fill. This happened on a Friday evening, I believe. It possibly could have happened on a Saturday evening, but sadly this individual lost his life on the following Monday in a hospital due to some complications due to that bruise or that damage done to his heart directly. The downfall here is the care that was provided to him on scene was a little bit misleading in the fact that they actually allowed this individual to get up, not backboarded or not C-spined, and allowed him to drive his personal vehicle or be driven to the hospital without being transported by ambulance. So we're going to talk about a couple of the different mechanisms of injury, share a couple of pictures here to talk about that. This is a head-on impact, so you can of course see the damage that's caused. As you can see, the passenger side is completely and totally disrupted and damaged. Obviously, by looking at this, you can have a pretty high index of suspicion of the type of injuries that you could be dealing with, and we're going to talk about those injury patterns here shortly. This is a frontal end collision at a pretty high rate of speed. The things to note is the amount of damage that's done to the engine compartment in the front of this car. A couple of the dangers to be thinking about, of course, is leaking fluids or possibly fire. Also, you seem to be on some uneasy ground here, so just kind of watching your step and so on. A couple of things to look at is you can see the airbag is deployed here on the passenger side as well as here on the driver's side. But you look at all this damage done to the windshield. There doesn't appear to be any distinguishing marks in the shape of a head, but that would be a pretty good indication that some head has struck the windshield. This all appears to be damage from the hood itself. Another frontal end impact, obviously you can kind of see based just on the way this car presents, the bumper seems to be intact, so you can guess this car appears to have gone under something, probably like a large size semi-truck, similar to what's behind here. But that might give you an indication of how much force was applied to the car. This one was a T-bone incident. You can again see the amount of intrusion or the amount of space that the car has actually entered into the space of the driver. So with that, just knowing that it's a high chance that this could have caused quite a bit of damage to somebody. The windshield is completely and totally destroyed, as well as so is the front of the car. This also gives you a pretty good look at leaking fluids and so on. This is after an accident, so the fire department has already provided some extrication on the door over here when we are taking care of this patient. All right. So the next picture here just shows you some damage done to this car as well. Obviously you can see the amount of windshield damage, so I have a pretty high index of suspicion that possibly some sort of object has came in contact with that windshield. So just kind of keeping those things in mind. So motor vehicle collisions have a couple of different injury patterns that are consistent with different types of collisions. We're going to talk about the up and over injury pattern as well as the down and under injury pattern. Up and over injury pattern, again, this is a frontal end collision. As you can see, when non-restrained, these patients a lot of time impact that steering wheel, which can cause a couple of these areas to be impacted. Neck and head injuries. This is pretty consistent with what we call a spidering of the windshield. So what you will is you'll have a circle with some impacts across the windshield. But it has a very distinct circle here in the middle. That's a horrible drawing, I really apologize. But it has a circle in the middle as well as some spidering in the windshield. I have a better picture coming up in a couple of slides. The down and under, what we're talking about is when they slide underneath that steering wheel and impact different areas. We have a couple of different types of fractures. There's a direct fracture as well as an indirect fracture. This would be considered to be a direct fracture because the fracture occurs where the body impacted the object. These femur fractures and possibly pelvic fractures are your secondary. As the energy transfers down the body, it actually causes these fractures due to that path of energy. Paper bag syndrome, what we're talking about is when a patient holds their breath to anticipate that impact and then impacts the steering wheel and causes some lung damage, possibly bruising that lung tissue or in some circumstances causing a collapsed lung just from the impact directly to the chest cavity with these patients having a full chest full of breath. Airbag deployment. One of the things they do recommend is that you lift the airbag, especially on the driver's side, to see if the steering wheel is intact, to make sure the steering wheel is not damaged in any way, shape, or form, as well as just seeing if that airbag has been damaged, if there's possibly an object or something you didn't see, or any safety considerations. One of the things that does tend to happen with these, as you can see, this flap over here on the passenger side has impacted the windshield. This is what spidering kind of looks like, except for notice how this is in a rectangular pattern. It's not in a circular pattern. So kind of know the difference between that passenger side having the possibility of that airbag flap causing some damage. Here in this next picture, this is what I was talking about with this circular pattern of that spidering of the windshield. As you can see, it follows pretty much a circle, and then it looks like a spider web inside here. This on the on the driver's side would be a pretty good indication of head injury. On the passenger side, it's usually higher up, as you saw in this previous picture here. This is real low on the dashboard. If you had that spidering up here, possibly, would be a good indication that it was possibly a head injury. A couple other injury patterns related to rear end collisions or side impact collisions. These provide kind of some unique issues. Lateral impact. This is only about 15% of our motor vehicle collisions, but this has a pretty large chunk of fatalities. This is about 22% of our fatalities. Real common for some upper extremity injuries as well as rib, clavicle fractures. Lateral compression also causes some issues. You can see the primaries the primary impact here that causes some damage. This obviously is an impact from one side. The one big thing that we talk about is this aortic injury. What happens here in these circumstances is when you're laterally rotated like that, your aorta has a really bad tendency with a lot of force to shear and cause that laceration of the aorta. That aorta at the aortic arch has the circulating blood volume for just about most of your body exiting your left ventricle. So this can cause substantial blood loss and almost always results in death. And it doesn't take very long to do so. That's a lot of blood volume loss through a very large artery that can cause a fatal injury extremely quick. This is a rear end impact. Obviously, neck and back injuries are real common with this, especially those whiplash style injuries. Even more so if they're unrestrained, as well as possibly not utilizing a headrest in their car. Always look for possible other injuries as well with these, but neck and back injuries are the most common. More side impact stuff, again, intrusion, what we're looking at. Entrapment's also extremely hard to deal with, having to involve extrication from the fire department to get us access into these patients. We call that disentangling or entrapment to get these patients freed. Rollover collisions, they tend to provide all kinds of possible injury patterns because the car's rotating. This can be end for end, this can be side to side, it could be the combination of the two. The other one that's also real common is the damage or injuries done by some sort of object that's rolling around inside the car. So any, tools or debris that might be in the car obviously can cause some pretty substantial injuries when it comes to these objects moving around. Rotational impact collisions, initial impact are often cause another impact as well. So these cars might be spinning out of control or impacting multiple objects. Falls, obviously a pretty critical mechanism of injury would be a fall of more than 20 feet for adults. Anything more than about 10 feet for kids can cause some pretty substantial damage. So if that's your initial call, we obviously have a high index of suspicion that these patients are suffering quite a bit of force going into their body. Characteristics of the fall, of course, we want to know, how high was the person, what surface the patient fell onto, what part of the body they impacted first, and then did anything interrupt their fall. In this case, this individual looks quite a ways away from this building, so I want to know where he fell from, if he impacted anything on the way down. Of course, did he possibly hit any of this lumber or this debris that's laying around that could have caused some additional injuries. This is just kind of review what I just talked about. The important factors is the height of the fall, as well as the surface of which the patient landed on. What part of the patient hit the surface first? Was this head first or feet first, or did he land on their side? And then they hit anything on the way down that would have possibly interrupted them or changed the trajectory at which they fell. Penetrating trauma, a couple of things that we talk about. The easiest way, in our opinion, or the easiest thing in our opinion to determine is the object itself, how much damage it caused. But I'm going to show you some cavitation style injuries that occur with bullets. The path of the bullet is easy to determine what's injury, but it's the pressure wave that can cause some additional injuries that are a little bit harder to predict. Couple different velocities. There's three different type of velocity injuries. Low velocity injuries, we're talking about a knife. Doesn't cause any cavitation. It's pretty limited. The damage is limited to exactly the area that was penetrated. The biggest thing to remember though is a lot of knife wounds are not straight in and straight out. They might be at a downward angle or an upward angle, or that object was moved around inside of the body. So just be aware of the fact that have a high suspicion for some additional injuries that could possibly be there. Medium velocity injuries, we're talking about handguns or shotguns. These can provide some cavitation, but not as much as these high velocity, which we're talking about rifle. And we're going to show you a video here in a second what that cavitation looks like. But what you're concerned about is the damage that's directly done by the projectile, as well as that pressure-related damage or cavitation. Also, if you know anything about ballistics or bullets, bullets tend to do some pretty miraculous things when it comes to ricocheting. They can cause bone fractures. or anything along those lines. What we're looking at here is going to be just a look at some cavitation. I'll try to pause this video the best I can to kind of show you what we're talking about. But this is a bullet. It's traveling at a pretty high rate of speed. This bullet is also designed to tumble, so you'll get a chance to kind of see what we're talking about. It's into some ballistics gel, which is to mimic skin or the body itself. So as you can see, the initial bullet traveled in this direct area right here, but what you're looking at is this pressure wave that causes additional injuries. I also want you to kind of pay attention as this wave goes through. Again, there's this permanent cavitation, so this is still the mark where that bullet has traveled, but you're going to see this pressure wave actually change, and it actually impacts itself and actually causes more of a larger permanent cavitation mark. So you can just see that just by one bullet there can be quite a bit of additional damage that's done to the body. Blunt force trauma, how that's defined is going to be trauma that's done to the body but that doesn't actually penetrate the skin. A good definition word there. You're going to see some test questions related to that. The downfall of blunt force trauma in a lot of circumstances, it's so subtle that we tend to overlook it. The big red flags with this is ask about where the body was impacted, as well as look for bruising or distension in the abdomen, any swelling or any crepitus feeling where maybe we just don't have any symptoms yet. But the best way to look for this is to actually use your hands on the patient, assess the areas where they were impacted to see if they possibly have an injury that you're missing. Nature of illness we talked about. This is the reason why the patient called EMS, whether it's chest pain or shortness of breath or nausea or vomiting or general weakness, all those kinds of things. You're going to utilize this to kind of gear your questions towards that. Just don't get caught up in the fact that the patient initially called for chest pain. It doesn't mean they may not also have some respiratory distress or some nausea or vomiting. So just be aware that that's also a possibility. Looking at that again, talking to the patient is going to be huge. If your patient can't tell you a chief complaint, then you're going to have to gather what you see on that patient to determine what that is. So maybe assessing, a body system or pupils or vital signs will key you into the possibility of what you might be dealing with. If you can't get information from the patient directly, obviously utilizing the scene or family members or bystanders to determine if this patient is someone that they know, or they might know some medications or some allergies. If they don't know the patient, but they saw the patient collapse or go down, of course, then they might be able to provide you with, did the patient fall, did the patient strike their head, or something along those lines that might give you a little bit more information when it comes to treatment or to management of this patient. Number of patients, this is kind of continuing along those lines of that skill sheet. Number of patients, and do you have enough resources? Number of patients is pretty easy. You're just going to count the patients. The one thing that tends to be a little bit problematic is those car wrecks that are later at night, possibly in some low light circumstances like the middle of the night or early morning. Make sure you walk around your scene so you're not missing any patients. I encourage about a 100-foot radius done throughout the scene, just to make sure that you're not missing any patients. Light up the scene the best you can, whether it's lights on the apparatus or flashlights or something along those lines. Just make sure you're not missing any patients. Same thing goes for car accidents. Make sure you're looking in different areas of the car. Make sure you check the back seat. Look under debris just in case that patient might have fallen out of the sight of emergency responders. Sufficient resources on hand. What we're kind of talking about is, do you need the fire department? A lot of people that may work for the fire department currently that are in this class to get their EMT certification. The problem is they're used to being the fire department on scene, or they're used to being the ambulance on scene. Never in a test question assume you're going to get those resources unless it tells you in that test question those resources are available. Tech rescue, whether that's high angle or low angle or confined space, tunnels, or swift water or ice rescue, something along those lines. Utilize those technical resources that you may or may not have in your area. In test questions, again, don't assume you have it. If it's a test or if it's a question option and we're talking about tech rescue, then of course utilize those. hazardous materials response, that's usually going to fall on the fire department as some sort of hazmat team. So make sure you're using those placards and that emergency response guide to take a look at that. So we're going to kind of talk about how to decrease the number of mistakes that you make. A couple of things that you can do. Scene assessment tends to get something we get complacent at. We do it a couple of different times. Some of the components of scene assessment is prepping your equipment prior to getting a call. When you're taking a look at your rig checks, maybe take a different route to the truck. I mean walking. If you walked the same way through your apparatus bays into the fire truck, you might miss something. So take a different route to the truck every once in a while and make sure that you're doing a 360-degree view of your truck to make sure there's no equipment in the way or something that's been left open. I've personally made the poor mistake of forgetting there's a piece of equipment in front of the ambulance and then leaving in that ambulance and causing damage to your vehicle or causing damage to that equipment. Starting with step 2 and finishing with step 1, just kind of changing up your routine, that will kind of force you to refocus on some things. We get complacent about checking cabinets for making sure there's 5 IV bags or making sure there's all the sizes of OPAs. You kind of change the order at which you check your supplies, then you might remake your body focus on the specifics, like is there truly 5 IV bags or is there only 3, which in a mass casualty circumstance might short you on the IVs that you are trying to utilize. Stagger the length. We're talking about the length of time when it comes to rig checks or equipment checks. Just change the time, do it a little bit faster or slower to see if that doesn't change the way that you're seeing things. All those things are pretty important. Then the one is kind of change your direction. If you haven't heard of this term before, KISS, basically what that means is keep it simple, stupid. So don't try to do complex tasks. Try to make it work smarter, not harder. Make it very, very simple when it comes to utilizing those procedures, especially if you're doing this when you're tired or something along those lines. Fatigue plays a pretty big role in mistakes and so on in EMS. So break that pattern. I'll tell you, this will work the best when it comes to tasks that require you to see, not look at what you were doing. It's easy to look at something, it's like the old, story of the mom who sends the little boy down, and the boy comes up and says, "Mom, it's not there." And then, your mom, of course, goes down and finds it. It's because you weren't really, you weren't really seeing, you were just kind of looking. You just kind of looked in the pantry for, a can of fruit or whatever, but you didn't actually take the time to see what was there and pay attention and slow down a little bit, so we don't want you making mistakes. That completes the chapter for chapter 11. Let me know if you have any questions in the discuss portion.